Okay, so welcome to Care Chat, where we lift the veil and pull back the curtain on senior care, demystify things related to adult children and their families, helping their aged loved ones, uh, age more gracefully and easily. And we're gonna talk to some old friends, new friends, colleagues, both not only about things locally here in Chattanooga, but also just national trends in healthcare or senior care. So this episode's sponsor is Ryan Home of Chattanooga, Cleveland, and Athens. Ryan Home provides caregiving services to seniors to keep them safe and independent wherever they call home. Full disclosure, I am a part owner in that business, so it's pretty easy to get this first sponsor or two. So today, I'm also your host for Care Chat, and I look forward to speaking with all of the guests we're going to have on. But today's guest is Emily Darras.
Hello.
Emily, tell us what your role is and where you work, and just give a brief elevator pitch on that, and then we'll get into detail.
Okay, so I work at Amedisys Home Health. We help people age at home. We provide different medical services like nursing care, behavioral health nursing, physical therapy, occupational therapy, speech therapy, social work at home, and home health aides to help with bathing.
Cool. So Amedisys, how long have you been at Amedisys?
Oh gosh, I'm going on 10 years.
Wow, nice.
Yeah.
So what did your career start out like? Where did you go to school? What was your education, and kind of what led you to?
So it's kind of a hodgepodge list.
Yeah, mine is too. I get it. Yeah.
So when I graduated high school back in 2003, I went straight into a program for massage therapy.
Okay.
And I was a massage therapist, worked with a chiropractor, then later on got my CTA and worked with him as a chiropractic therapy assistant, as well as the massage therapist in office. Later on, I started my own business and I did massage therapy. And while I was doing that, I just felt like I love helping people, but I just wanted to be able to help people on a little bit more broad spectrum. And so I went back to school for my nursing degree when I was 23 and graduated from there, went to Memorial and worked there on an orthopedic floor and kind of floated around to see, what different areas of nursing were interesting to me. And finally landed at Amedisys right after my first son was born. I actually carried him on my little shoulder. He was 2 weeks old when I went for my interview at Amedisys.
Oh wow!
I know. So
that's
I think that's how I got the job, was by being a really cute
yeah.
baby.
I'm sure that. I mean, how could they tell you now, right?
Well, it was. I was a little nervous about it because stepping out of the hospital and into people's homes is like vastly different, as you know.
Sure.
But I felt really strongly that my career needed to go into a direction of personal service. In the hospital, you often kind of get torn in like 15 different directions at once.
Yeah.
You have call lights going off and bed alarms going off, and you can never spend like one-on-one time with your patient.
Very reactionary.
Yeah.
Yeah.
And I felt like we kept having these frequent flyers, patients who couldn't stay out of the hospital, and it was like every other week I had the same patient in my bed. And I kept thinking, what are we doing that is not working? What can we do that will work? And so when a friend of mine who worked for hospice, when she started talking to me about what she did, I thought, wow, what an amazing opportunity to go to people's homes and make a real difference where they feel most comfortable and can actually hear what you're saying and make changes in their life that are going to lead to a longer, healthier, more quality life. So that's why I went and took the job once they offered it.
Yeah.
As the cute baby. And I haven't looked back since.
That's awesome. Well, we've worked with Amedisys throughout the last 6 years that we've been open, 6.5 years, and obviously the company you went to, Amedisys is one of the absolute like go-to places in town for sure. And
yeah.
And I think that, I mean, just from an outsider's point of view, if I've had a few clinician friends that have wanted to make the leap from one type of what they do. Maybe they're in a clinic or at a hospital, but they want to get into home health. They, that always comes up of like, well, here's the like two that I would say start with. If they can take, if they're hiring, that's where you need to go. And Amedisys is for sure on that list. So, I mean
it's a great company to work for. I love the fact that I was able to start in the hospice section of it and transition over to home health. And if I ever want to go back to hospice, I can just transition back over into that arena. But just being able to be in patients' homes, making a clear-cut difference with them, and being very focused on them for the time that I'm there. I'm not having to answer call lights or say, hey, I'll be right back. I've got to go, run and make sure I take care of this emergency situation. I can sit and educate them and take care of their wounds and take care of them as a person. A lot of what happens when you are in a home taking care of someone is you're not just healing their body, but you're giving them the opportunity to have personal interaction with another human being.
Yeah.
And when you think about these aging folks that are at home, it's not like you and me. I can hop in my car and I can run to Starbucks. When I'm ordering my cup of coffee, I'm going to talk to the barista. I'm probably going to talk to people that are sitting down when I sit down wait for my coffee. I'm going to have opportunities to have many conversations throughout the day with many different people. And I'm going to be able to interact with their energy, they interact with mine, and we're sharing. And when you're at home and you're unable to get out, you're no longer interacting with other people's energy and sharing that. And the amount of lonely that takes over you, that is one reason I think why people become so sick, is because they're not able to experience that energy transfer with another person. So it's such an amazing line of service, I think, to be able to go in the home and help interact with people while you're healing them.
Yeah, that's a really good point about. I mean, even when you go to a hospital, you're not really interacting with. I mean, you have interactions, but they're so black and white and kind of cold interactions for the most part. You may have a nice nurse, a nice doctor, or whatever that's coming by, but it's not really going to be about much of anything other than why you're there specifically.
There's not as much intentional interaction.
Right.
Like right now, you and I are having an intentional interaction. We're making eye contact. We're speaking to one another on several different levels, even though we're focusing on what I do and what you do, but we're sharing little anecdotes with each other. Like, you're telling me about your children, I'm telling you about mine. We're sharing our life with one another. And in the hospital, you don't get that same type of interaction. So,
before Right at Home, I come from zero healthcare background. We opened Right at Home in August of 2016, and little did we know what we were really getting into, right? And it's been super rewarding, obviously, and really what we knew at the time was, okay, well, we know we're helping people, right? And that's kind of twofold. I mean, we're not only helping the client or the patient, we're not only helping the family who may not have all the freedom to be able to check on mom or dad all day or whatever, but also we feel like the focus on our employees at Right at Home has been a huge factor in our growth over the last 6.5 years, and we really felt like that part has been missing from a lot of healthcare in general, but just having that employees first, clients second type mentality, which we're actually very proud to publicly talk about. And I think a lot of places are afraid to do that. It's kind of like, okay, the priority isn't just getting your shoulder moving again after surgery.
Yeah.
It's also what are you eating properly, and are you doing activities that are not sitting on your recliner watching television? It's like being able to think past the exact reason that got you in the door, but it's like, all this, like, it just branches out from there on
Yeah.
all these other opportunities to help the person. When you're put in a physical space of their personal home, it just changes the conversation completely. I think that's really good. That's a really good point. I haven't heard that side of it from a lot of home health folks, not because they probably don't feel that way, but because it doesn't always come up.
Yeah, I think a lot of times you get stuck focusing on the actual things you do, you know, the scientific, all the things that you learn in school. But I feel like going back to what you were saying about focusing on employees first and patients second, it is absolutely 100% one of the most important things, I feel.
Yeah.
If you have a happy employee and you have somebody who is not only happy in their job, but happy in their work-life balance so that they're happy at home,
Right.
their cup is overflowing. They have all of this like beautiful, joyful energy that they're bringing into this person's home. And when you feel a certain way, it's going to spill over to the person you're beside, right?
Right. Right.
So if your employees are happy and joyful and feeling like they're appreciated, they are being taken care of, it's going to make them appreciate and take care of the ones around them.
Yeah. Yeah.
And if as the patient or as the client, you know, you welcome this person into your home and they light the room up, there's something different about that than somebody who's clocking in to get a paycheck
Right.
and unhappy with the place they're clocking into.
Right.
They're going to walk in and client or patient will sit there and be like, I feel uncomfortable. Like I feel
'Cause they know the energy.
guilty that
Right.
they're here because they clearly are unhappy. Is it me? Are they unhappy with me? And then they internalize that and feel like there's something wrong with them.
Yep.
And so making sure that you're taking
That's a good
care
point.
of the people that work for you, I mean, that is what will take care of your business.
Well, and I think you know, at this point, and we're pretty public about a lot of our, and transparent. You know, we always talk about transparency and honesty. And you know, in that 6.5 years, our caregiving team has grown to about 100
Oh, that's amazing.
caregivers, which is pretty wild. You know, we're building out a training center in the office where we have really 4 people focused on it, just recruiting, retention, and training. And that's, you know, something that I think is important in our world is like, okay, so in our world of, you know, a clinician or a caregiver or a CNA goes into a home, there's not like another resource down the
Yeah.
hall if something's not going well, right? It's like
Right.
we really need to equip everyone with the tools to be successful. And you know, survey after survey after survey of what do you want most out of your employer in healthcare is training. Training is always top of that list, and pay, while on the list, is typically like somewhere 3, 4, or 5. And training is typically always number 1 or 2. And I think that's a massively overlooked opportunity for home care, home health, hospice, anyone in healthcare, even you know, even in a traditional hospital or just a you know, a family practitioner office is those training opportunities. People do the stuff they have to do, like CEU type things, but you know, I think there's a lot of opportunities for things just like you know, work-life balance classes, right? Like why only provide like, here's this medical procedure thing that we're going to teach you today. It's also like, well, here's how to like go home and eat healthy yourself. I know you know how to do it with your client, right? But here's how to take care of yourself.
I think about it like a family.
Yeah, absolutely.
I mean, think about your kids.
Yeah.
You want to make sure that they know their ABCs and their 1, 2, 3s and their shapes and colors and all of that before kindergarten, right?
Right.
So it's not just your daycare who's teaching those things. You teach those things at home, but you're not just going to teach your kids the basics. You're going to start as they continue to grow in your home, in your household. You're going to start teaching them other life skills. You're going to teach them how to make a sandwich, how to, you know, bring their laundry into the laundry room, how to load the washer. You're constantly teaching them. You're constantly making everything fuller, bigger, brighter for them.
Right.
You're not going to continually do all the background stuff for them and let them continue to be a 3-year-old
Right.
until they're 18 and then shove them out the door.
Right.
So with any workspace, I feel like it's so important for them to embrace you like your family and help you build your life while building in your own career.
And it's funny you say that. We're on February 1st, and if you're listening or watching this later, today is January 12th, 2023. But on February 1st, we're launching a new caregiver career ladder, and people can come in with virtually no experience, and over the course of time they can be trained up, and we'll even give opportunities to go to CNA school and things like that as well if they want to continue that ladder or go on into nursing. We're big advocates of people kind of growing out of what we need, so they can grow into something like home health or hospice or another healthcare type setting. So but I think just knowing like, hey, these really, really good employees may not be employees forever,
Mm-hmm.
because they may outgrow us in that way of like of their education or desire to help people in a specific way that's not something that we do.
Right.
And
but even if you're not gaining a lifelong employee, you're gaining a culture.
And we hope a lifelong advocate
Yes.
for what we do, right?
Right.
Like that's the two things, right?
If I get a job somewhere and I'm like, oh, this place really stinks, like I am not enjoying myself here, when I move on to the next job, I'm not going to tell a friend who's coming up in their career, hey, you should check out so and so. Like,
right.
I had a job there for a year and a half. It was fantastic. No, I'm gonna either not say anything about that place of work, or I'm gonna tell the person, that was literally the worst job I've ever had. I would never recommend it.
Right.
So whenever you are creating this culture of growth and personal growth and support, you are creating all of these people. Say you have 100 employees right now, and those 100 employees leave over 5 years from now. Now you have 100 people marketing for you in the community.
Absolutely. Yeah.
And they'll market hard for you because they enjoyed their time here.
We joke there's more people that used to work at Right at Home than currently work at Right at Home, and we hope that it's like for those good reasons, right? And I think that driving home like positive culture and thinking about I'm going to train this person and really that training may benefit another employer more so than it's going to benefit us is the only way for healthcare to get better.
It is the only way.
I think people that are thinking these short-term gains of like, well, let's just offer them a lot of money and they'll say yes, and then it'll be a terrible culture. They'll leave no matter what in 6 to 12 months. Those people are playing checkers, and I think that there's only a handful of places who are playing chess, where people are thinking several moves ahead, and that's going to be the way that things are going to get better, not just from a quality of care perspective, but also just like recruiting people into the workforce from high school, college, because it's, people say like, hey, healthcare is a great place to be working right now, but I can tell you the attrition rate is super high because people get overworked, they're undervalued, and they go off to sell insurance or do real estate or do, because it's way too emotionally and physically taxing to log these 60 to 80 hour weeks over and over and over again. But that being said, I could go on that forever.
No, and I could too. And that brings me back to the whole point of taking care of the people who you hire.
Right.
And teaching them how to take care of themselves as well as your clients or your patients. I think it's so important to let them know that they need to take a step back and say no at some point. You know what I mean? work your 40 hours or work your whatever it is that you said that you were going to work.
Right.
But take care of yourself on those off hours. I know in my first couple of jobs as a nurse, when I worked over at Memorial especially, I had a very hard time saying no, and I would work 17 nights in a row. Why not?
Yeah.
14-hour shifts. Well, stay 16 hours if
Yeah.
you want.
Yeah. Yeah.
And it creates this cycle where you're burning at both ends, and then you get to the very middle and you're like, I don't even have enough left in me for me,
Right.
let alone to give of myself to somebody else. And as you said, in the healthcare field, you are put in situations that the average American or average citizen of the world is not going to be put in. Even as a CNA or a caregiver in the home, you're going to have those emergency instances where you have to make swift actions, swift choices that could have this person's life kind of dangling in your hands. And it's really important to be able to take the time and know how to decompress and know how to process those things. Or even as a caregiver going into a home and just seeing a really, really sad, heartbreaking situation and letting that person talk to you about what's going on with them, and being as the sounding board for that person, being able to process it yourself and walk out the door and go to the next client's house with a smile on your face. It's important for us as a community to learn how to take care of ourselves, because you can't continue to work year after year, day after day, and not process those things.
Yeah.
Because then you get home and you don't know how to deal with regular life.
So true.
It's like soldiers when they come home from war, how do they just automatically integrate back into a regular society? They have to take time to decompress, process what they've been through, and then relearn how to be here, how to do this life.
Yeah.
And I feel like we don't really give ourselves that, because we're like, oh well, we didn't go to war, we didn't do anything big. Oh yeah, we did. We just ran a code. We just performed CPR on the side of the road. We just did this. We just did that. I just went to a home and a patient told me all about taking care of their child that was dying and how that felt. Like, that's heavy. That's heavy on our hearts. And if we don't take care of processing that and learning how to deal with what we're seeing and what we're hearing, we can't continue to give up ourselves.
Yeah, there's no doubt that it does remind me of a story, and hopefully we can leave it in. I'll check. But we had a caregiver. This was several years ago. Sitting with a client who was admitted to the hospital, and she felt like he was going into cardiac arrest in his room, and was like pounding the button, and I won't name the hospital obviously, but pounding the button, and nobody was coming. And she like yelled down the hall, nobody's there. It was the middle of the night, obviously, staff's down or whatever, but she ended up getting him into the chair, wheeling him down to the ER, and they saved his life. But it was crazy, because she had the wherewithal to like
make the decision
that needed to be made, right? Mm-hmm. And I will never forget that story. And that same caregiver has gone through personal loss, and I just don't know how people handle all of the things that they handle and just still dig deep enough to give a little bit more. And it's crazy to see. I'm always completely surprised, because I'm like, I would have folded like long ago. Like, if I was put in those, some of those situations that our folks have gone through, and that, it's just wild. So let's bring it back to your role at Amedisys, Care Transitions Coordinator.
Yeah.
What does that even mean?
It's a mouthful. So if you've heard the word liaison,
sure.
You're the go-between from one thing to another. I'm the go-between between Amedisys Home Health and my accounts. So I cover one of our large hospital groups in the area, and I basically work with the physicians and the case managers and the clinical coordinators at the hospital and make sure that they are educated on different resources for the patients who are going to be discharging the hospital. So namely home health. But
Sure.
I don't just stick to home health in general, because patients have a myriad of needs and issues as they're trying to get home. I may have, an 85-year-old man who just recently lost his wife, in the hospital for new onset diabetes, has congestive heart failure, all these other comorbidities, right? Well, he's going to go home and he's expected to take care of himself, right?
Right.
So the case manager will call me and say, Emily, I've got this guy. He's supposed to discharge today. Do you think you can get him set up with some nursing and therapy services to support him in going home and his transition? Well, sure. Yeah, I can do that. And that's perfect. It's what I'm here for, what I'm being paid for. But let's dig a little deeper, because if this man is going home by himself and he doesn't drive, so he's having a neighbor come pick him up and take him home. Well, that neighbor works full time, so can't be with him all the time.
Right.
Well, now he's home alone. He doesn't really know how to cook. His wife was the cook and the house clean. She did all of the domesticated stuff.
Mm-hmm.
And now he's like sitting there. He doesn't know what to eat. He's now a new diabetic and he has congestive heart failure. So he needs to be on a diabetic cardiac diet. But the man doesn't know how to cook. So he's eating out of cans.
Gosh, you're describing my grandfather.
Yeah. He's eating out of cans. He's going in
yeah.
the freezer and getting, the hungry man dinners, popping them in the microwave, sitting down to watch Jeopardy. And he just doesn't know how to take care of himself because his wife took care of him for 65 years.
Right.
And now she's gone. And now he's left wishing she was there. He's depressed. He's alone. All the things. So, yes, sending a nurse out to help him, that's wonderful. The nurse is going to go out there twice a week.
Right.
The physical therapist is going to go out there 3 times a week. So he's going to see somebody once a day, which is huge. But what's going to happen the 23 hours that we're not there?
Right.
How is he going to be able to get the groceries he needs, prepare the meals that he needs, clean his house, do his laundry, get in and out of the shower properly without falling? Like, there's so much more to this little man's needs than what my company may be able to do for him. So I always try and give my case managers several other resources and say, I'm going to go ahead and start working on the home health aspect. But here, why don't you, does he have a daughter? Does he have a son? Why don't you call them and call him and see if he might be, is he a veteran of war? If he's a veteran of war, maybe we can get him set up with a VA aid and attendance so that he can financially be able to pay for somebody to come into his home a couple hours a week and help with some of that stuff that he is not used to doing and doesn't know how to do. So I always try and give them a couple other options to help with that transition home and help them have a more successful transition to home without rehospitalizing.
So a couple things, I mentioned my grandfather. That's almost exactly his story in a lot of ways before he passed away. But I remember going to visit him at one point, and it was like opening a can of beets for lunch, can of beans for dinner, and it was like, okay, so are we eating anything else besides? Because I literally was like across the table. I had my own can of beets, which
I love canned beets.
I do too, and I didn't actually know I liked them until then.
Nobody knows about them.
No.
They're great. They're really wonderful.
Yeah, I loved it. It was never something I went out and bought until after I went and visited him that time. But yeah, it was canned beets for lunch and a can of baked beans for dinner.
And as good as those things taste, it's just not a full whole diet. It's not going to support his system. It's not going to give him the nutrients that he needs. But he didn't know any better. He didn't know what else to do. Right.
So you telling that story, I was like, oh my gosh, have I told you about him already? But yeah, I think just there's a lot to unpack, and it's hard to expect any one person, like you. I mean, it's hard to expect you to be able to point someone to every possible resource they could use.
I just feel like
And
people don't quite understand what resources are out there.
right.
They feel like they're the only ones in the situation. They feel like, there's nowhere else to turn, there's nothing else to do, so let's just call an ambulance.
Right.
And there's so many options, they're just not readily available to people. And I would love to see the community come together and present options on a more visible basis for people.
Well, and I do think, that's a big reason we're here today too.
Yeah.
Like I want
love this.
Yeah, this is great. I think one of the, my parents are getting older. My mom turned 70 yesterday.
My dad turned 70 on January 8th.
There you go.
Yeah.
Wild.
Very.
And they're in great health, but they live about 200 miles away, and so it's just like a thing in the back of my mind. And even with everything that I know, I still don't feel comfortable knowing what to tell them about everything. I still don't know everything that's out there.
Right.
I was one of those people. I didn't know there was a difference between home care or home health. I assumed hospice was a terrible thing. It's not.
Oh, it's amazing. Yeah.
And it's like all of those little things, and that there's nutritionists, and that there's concierge medicine, which I think is a huge thing. I talked to somebody about yesterday on here of just private pay physicians. I think
it's amazing.
Is so great. Anytime you can pull insurance out of the equation, I think it's going to help change things for the good.
Oh yes, being able to bypass a non-medical entity,
right,
making the choices for your health, like
right.
What a gift.
Yeah,
what a gift.
And it's just, I think those things are going to be the things that really propel it forward. Home care has been, with caregivers and things, it's been around for a long time. Some of it's like culturally a community thing, it takes a village type stuff, but even in our industry, which has been really rapidly growing for, call it 15 to 20 years, was accelerated by the pandemic. And this keeping seniors safe at home was like everyone talked about.
Yeah,
right?
and so, I'm really glad you brought up the pandemic. So I think the pandemic was kind of it was horrible, but it was an interesting case study for people. The majority of us live a busy, fast-paced life, right? You're get up in the morning, rush to get the kids ready, get them to school, get to the job, go to your lunch meetings, do all the things, take your kids to after-school programs. You're so caught up in life, you're not really thinking about anything but just getting through the day.
Right.
Well, then pandemic hits, and all of a sudden, you're stuck at home. And the only people you're interacting with are the people that are stuck in the home with you. So say you're a single person, or you're just a young married couple, or an older married couple with your kids gone, or you're an elderly person and now you're truly stuck at home with nobody knocking on the door.
Mm-hmm.
I think the interesting part is, before the pandemic, how many people really thought about what it would be like to be at home all day, every day, for days, weeks, months, years?
Right.
How many of us really thought about what that life was? We didn't.
Right.
We didn't, because it was never something that was a part of our life.
It wasn't going to be.
It was never.
We were never going to be able to figure it out.
You never faced it. Yeah. And then all of a sudden, the entire world was forced to live that life, even if just for a few months. We all lived that life of being at home, and the only point of contact we had was, video conferencing and phone calls and internet and TV. But that was our interaction with the world, was through a screen. What if we didn't even have the screens?
Sure.
Because many of these people at home, they don't even have like a smartphone. They don't know how to use it, so they don't have it. They have, the old flip phones.
Right.
They have a TV, but they're on regular cable.
And that's just a one-way.
Right. That's just
thing,
a one-way.
right?
There's no real communication. There's no give and take. So I think it's interesting that we all went through that. We can all look back at that and say, that is not for me. Like, I don't want to live that life. If I have
Right.
any way to avoid that, I want to avoid that. So I feel like it should give us the ability to really empathize with people who are homebound and understand we need to make sure that they have access to things long before they get to the point that we felt during the pandemic. I mean, I know
Sure.
that my mental health was not the best.
Yeah.
I was
Right.
so lonely. I just
Yeah.
needed to talk to people and hug people and just touch somebody.
Yeah.
You know, so I think it's interesting. I think it gives us a little bit more perspective on that.
Yeah, for sure. And I remember when the lockdowns went in place. I was just like, wow, this is gonna be the craziest 2 weeks.
Yeah, I know those 2 weeks were so long.
And then it was like on, and that was back when we were like wiping our bananas with bleach wipes and weird stuff like that. And but I think you're right. I mean, I think it placed a huge emphasis on just mental health of socialization, and I hope people remember now that we're hopefully kind of on the other end of of everything, that there are people who, like you said, that's their reality all the time.
Yeah, the pandemic was nothing special for them.
Right.
Like, they were going to be at home anyways.
They're always stuck there, and there's always that limited socialization and interaction.
And speaking to you, your parents live over 200 miles away. So you're not readily available to them on the regular, right?
Right.
I mean, you could go down there for a weekend and come back, but you're not able to like pop in for lunch or bring them a hot dinner. And I think it's really important for us, for our generation, to start thinking about these things in preparation for our parents as they age, and start looking into, what are the options as mom and dad age? What are their wishes? What can I do to prepare for their wishes as they age and as they may, come into more poor health? What can I do to support them in living the life they want to live?
Right.
It's important for us to start educating ourselves now. Like, educate ourselves on what home health, what hospice, what home care, what concierge, what home visiting physician groups are.
Right.
What are these things and how can they affect my parents' lives as they are aging?
There's something we used to do, and I think we're going to probably do it again now that I think about it, that you're putting it that way. We had an ICE form, or an in case of emergency form, and it was essentially this. It was like, okay, hospital blank, home health blank, home care blank, hospice blank, and essentially it was like, well, let's figure what choices are out there now where we're not having to
when it's not
make
stressful.
A decision in an hour.
Yeah.
And we can kind of figure out like, okay, well, this is a quality company, they have good reviews. I have a month to call around and ask my friends who has had experience and who they would recommend, and then it's just that part's figured out of like, okay, if I hear someone mention home health or hospice, I know I just have to look at my piece of paper. This was a decision that was made with a logical mind. That wasn't it wasn't an emergency, right? And I'm thinking on that of just thinking like, okay, well, here's a number and a place I can call for meal delivery, or like, and me having a copy of that piece of paper from, if my parents have it, and if they do get sick, even, let's say it's COVID and they have to hunker down at home for a week or two or whatever the current requirements are, I have that form and I can be like, hey, I can get a meal delivered to their door. Maybe it's DoorDash, maybe it's Uber Eats, maybe it's, Mrs. Smith's Meat and Three kind of place down the road, but at least I have something that I can be like, hey, let me get you like at least one good meal a day dropped off at your doorstep.
Thank God for like the services that bring your groceries to you.
Yeah.
I use those
it's pretty wild,
now.
right? Like, it's so much has changed so quickly because of that urgency of it. It has to change right now for things to exist, like eating meals and like.
But it's so
stuff,
nice now because, like you said, when your parents start to age or when they get sick, knowing that you can be like, let me make you a quick Walmart order.
Yeah.
let me make you a quick Aldi's order or Publix order. I'll have it delivered to your house.
Yeah.
Is tomorrow a good time for them to deliver it in the morning?
Right.
Okay, perfect. It'll be at your door.
Yeah. It's so easy.
Yeah.
Honestly. So one question I have is, so what's a perfect like client for you? Like what's a perfect situation where if someone calls and they rattle off kind of what's going on, you're like, oh my gosh, we're going to be able to have such a big impact on this person's life. What does that client or patient or family member, what does that situation look like?
Okay, that's a really good question. Insurance has a lot to do with it.
Sure.
So we are a company that runs on insurance. Our main payer source is Medicare, traditional red, white, and blue. And if you have traditional red, white, and blue Medicare, you have like complete and utter access to any of our services.
Okay.
As long as there is a medical necessity. So with that being said, we can't come out and see you unless you have a medical necessity because we do bill insurance. But a medical necessity can look like you have a new diagnosis of diabetes or congestive heart failure, COPD, hypertension, high cholesterol. You've had a recent change in your medications. You've had a fall recently. You have had a urinary tract infection. You're weaker because your blood pressure has been kind of out of control and you've not been on top of your meds, or your diet has had to change because you've lost a spouse. Or maybe your adult children were taking care of you, but they had to move to another state because of their family. So now you're left at home and you're kind of at a loss of what to do. And so you're not taking your medications right, or you're not eating right, and you're starting to decline. Any type of decline or new issue is a great time to call us.
Okay.
Yeah.
That's perfect.
Yeah.
Yeah.
Anything
new
like
issue or any decline.
Yeah.
That, I think, just getting it down to that simplest form of like, okay, I get that.
Yeah.
That's perfect. That's perfect. So, and this question is another one that I try to ask everyone. So, with things changing as quickly as they are in healthcare and just the world in general, I guess, it's important that everyone kind of stays on top of things, right? And
huge.
and continues that education and learning. So what are your kind of go-to ways that gets that student in you out? Is there any online resources that you always kind of go to read kind of the latest stuff, or are there other industry experts that you call on? Are there specific journals or print or conferences, that kind of stuff?
That is a good question. I'm really bad.
I doubt that.
Well, so I'm not big on like just reading things. I'm a very like verbal learner.
Sure.
So
Yeah.
I love conversation. So when I feel like there's new changes, either coming down from Medicare or coming down from different lines of service in the medical industry, I like to go out into the community and talk to different nurses and physicians and therapists, and just kind of get a feel for what's going on in their world. What are the changes they're seeing? And then, what's working? What is the actual change coming down from Medicare, and how can we work around it to give the same amount of care as we were giving previously?
Right.
So I'm like a big ideas person. Amanda knows that. I'm all about big ideas and how to come together as a community to get the same thing done that we were doing before, or something better.
Right.
But work around.
Yeah.
Because there's always going to be changes. Nothing's ever going to stay the same in the healthcare industry.
Right.
And if you don't know how to roll with the punches and how to figure out how to still get your job done, you're not going to be able to be successful in it.
Sure. Yeah.
So
absolutely.
I definitely applaud those who are like reading all the journals and all the things. But like I said, I'm really more of like
get out there
person to person learner, and kind of see what the problem is and figure out how to work the problem.
I like it. So if anyone listening to this or watching this is thinking, okay, this makes sense for my mom or dad because, I had never really thought about it in the simplest terms of, is there a decline? And yes, I've noticed, Christmas was a few weeks ago, and I went home and there's food spoiled in the fridge, and there's just these like early signs of this isn't normal.
There's some decline.
And so if they feel like, hey, this kind of makes sense, what is the best place for someone to reach out to either you specifically or Amedisys? I know Amedisys is a large company. They've got a lot of locations, so it may not just be in Chattanooga, but what's the best place to get in touch with you?
To get in touch with me personally, my work cell phone number.
Sure.
Do I need to give that to you now?
You can. We can link it up in all the other things, and that's fine too.
I'll give it to you, and you can link it up.
Yeah, perfect.
But we do have several different care centers across North Georgia and Tennessee. Well, we're nationwide, but in this area, we have Alabama, Georgia, and Tennessee care centers. So I can give you some of those links that are going to be the closest ones. But if you reach out to me or to one of the care centers, all you would have to say is, hey, my name's Jenny Brown, and my mom, there's just some things going on. This is what I'm seeing. And then we can say, okay, from what you're telling me, I would recommend a nurse come in and educate your mom. You're saying that your mom is, it seems like she's lost a little bit of weight. Her fridge is kind of having some spoiled stuff in it. She's not getting around as well as she was. You've noticed that her feet are a little bit more swollen than normal. Her face seems a little bit more swollen, and she's a little bit more forgetful. And you're afraid she might have a fall because she's kind of like furniture surfing as she walks through the house. So these are some very valid concerns of yours. So in this scenario, I would like to go ahead and get your mom's date of birth, name, and her primary care physician's name, and I'll give the primary care physician a call and talk to them, be kind of that liaison for you, and ask them if they might give us orders to send a nurse out to do a little bit of observation and assessment and some education for her. And then I would also like to add some physical therapy, because if she's furniture surfing, that's telling me that she's having some issues with her steadiness on her feet and maybe her strength. So let's get physical therapy in there to evaluate her, see what they can do, see what kind of goals she has, and how they're going to get her there. And then I would also like to get orders for a medical social worker to come out and just evaluate her for what is in the community that would help her stay at home longer and be more successful, right? Is she able to get her medications in a timely fashion? Is she able to get her groceries in a timely fashion? Does she have a ride to and from the doctor's office? Does she even get out to see her doctor often enough? What are the things that would help her manage a higher quality life and stay home? So that's what I would start with for that scenario.
And I think my biggest takeaway from what you just said is there is, number one, no harm in calling to ask. And it can go a couple of different directions. One, somebody comes out and yes, there's significant things going on that we can immediately come and be a part of helping, or there's not an immediate cause for concern, but let's look at community resources for some preventative activities and things. So I think it's a win-win just by calling and checking. So I think we'll leave it at that. That's a perfect place to stop. And Emily, I just really appreciate you coming out and doing this. This was awesome. Yeah.
That was wonderful.
Thanks.
Thanks.